Retailer today. Always read and follow label directions.
Got about 7 minutes before 8 o'clock. We'll have CBS News at the top of the hour. Joining us in the studio this morning, I can still say it, I guess, the new CEO of Passavant Hospital, Doug Rahn. Mr. Rahn, thank you very much for joining us. Appreciate it. Why? You were at Memorial Health System, solid position there. Why do you want to lead Passavant Hospital?
Well, as we worked on the affiliation, I had an opportunity to really see and meet many of the people in the organization and really got excited about the opportunities that I saw ahead for Passavant and for Memorial. And my roots really lie here in Morgan County. My wife and I live outside of Murrayville, and it felt like I was really, in a sense, coming home, if you will, even though Springfield's not that far away. But I thoroughly enjoyed my experiences at Memorial, and we'll continue to work closely with them. But it really felt like an exciting opportunity for both myself and for the community, because I think I can help bring the best of Memorial here in a timely manner, while still keeping the integrity and the heritage of Passavant as we move forward through a lot of the changes that we're facing.
For the most part, Passavant, a rural hospital, these are challenging times for small rural hospitals. A lot of us felt this affiliation was the best hope for the future, but this is not going to be easy, is it?
It won't. We're in the fourth year of the Accountable Care Act. It's very complicated, and for people that aren't familiar with the details, it's hard to overstate the amount of change that the healthcare industry is going through across the country. It's not just Illinois. And one of the things that our country has said is that we just can't afford to continue to let healthcare costs climb to 20% of GDP. We've got to start to get a handle on it. So there's a lot of changes that have been going on over the last 4 years, and there's many more to come. And some of those changes make it hard for smaller organizations in rural environments to have the economies of scale to adapt. For example, information systems is just one of many of the significant changes that have to be implemented if you're going to be able to meet some of the demands that our government have placed on the healthcare system.
You've heard some of the fears that a lot of people have. Well, now Passavant's a part of Memorial and we'll lose our identity. There's no more local to Passavant. How do you hold on to that?
Well, I think one of the things that everyone should take some pride in is the role that the board played in negotiating this affiliation with Memorial. They were very concerned about that. They made sure that those protections were in place. This hospital, Passavant Area Hospital, will continue to be governed by a local board. And while there certainly are some reserve powers, if you will, for large investments, for example, that will float up to the health system, most of the governing decisions will continue to be governed by the local board, and that's very important. There will be 2 representatives from the Passavant Area Hospital Board on the health system board, and they will have a voice at the health system. But then I think just as importantly is that I would ask people to look at how Memorial has handled their other affiliations in Lincoln and Taylorville, for example. We've maintained that local autonomy while still bringing the best of what Memorial can bring from a large regional provider perspective, but still allow the local organizations to do what's right for their communities. And I'll continue to carry that philosophy forward.
We tend to look at it from our perspective. In fact, at Passavant's Jacksonville, it's our hospital. You can show us perspective from the other side. What made Passavant attractive to Memorial Health System?
I think there were a number of factors. One, there's obviously a strong connection between Springfield and Jacksonville. A lot of patients were seeking care in Springfield before this affiliation. We hope that we can enhance some of the services at Passavant, whether it's availability of specialists or technology, so that patients don't have to travel. So there was already some of that strong connection. There's a lot of physicians within Jacksonville. We have a medical staff of, let's say, 75, 70, 80 physicians. A lot of those physicians also practice in Springfield. So there was a strong connection there. So I think when we looked at what we need to do as a health system in terms of market presence and access to care, Jacksonville was a very natural fit for the health system.
How out in the community will you be?
As much as I possibly can. Now, I would ask for some indulgence as I get started the first year or so, but...
I mean, you can't spend like 4 or 5 hours out of the office just floating around in the community?
I'd like to, but no, I think that's one of the most important roles for a CEO in this size organization to do, is to be active in the community, and I'll certainly try to participate in as many of those activities as possible. Need some time to get through some of these changes in the integration. The next year or two are going to be pretty busy. And but I'm very much looking forward to meeting many of the community leaders and a lot of the different organizations that we get to work with.
I don't know if this is a fair question or not, but how long before you feel like you're going to be fully plugged in?
That's not a fair question.
Okay.
We've got a pretty detailed 120-day plan to really just make sure that I take enough time to learn what's important in the organization, what's important to the community. But it'll take a full 6 to 12 months before I really understand a lot of the dynamics and some of the priorities, and we start to link that with some of the strategy that we need to implement going forward to adapt to healthcare reform.
And you were COO with Memorial, correct?
I was. I was the Executive Vice President and Chief Operating Officer of the health system.
But you've had experience doing this before.
I have. I've actually been the CEO of 2 other hospitals in Michigan earlier in my career. A little bit smaller than Passavant, but very similar size. So I have had some experience working in smaller organizations.
And probably the most important question I'll ask you this morning, are you a Cub fan or are you a Cardinal fan?
It depends. Right now, I'm definitely a Cardinal fan. No, I'm definitely a Cardinal fan.
That's good. We will give you our blessing then
Thank
with
you.
that. Had you said a Cub fan, I'm not sure where the final 30 seconds of this interview would have gone. Thank you very much and welcome aboard. We
Well,
really
I appreciate it. Thank you, Gary.
And you're available to the public?
Very much so. I would welcome questions. If I need to respond to issues or concerns, happy to get involved.
All right, very good. We need to break for CBS at the top of the hour. This is WLDS Jacksonville. Time at the tone is 8 o'clock.